Most of us were raised to be resilient, believing that if something doesn't hurt, it's likely not an emergency. You might think a sudden dizzy spell or a brief moment of slurred speech is just a sign of fatigue, something that will surely pass with a little rest. But in my years of clinical practice, I've seen that this silence is often the precursor to a catastrophic system failure. Think of your brain as a precious library. For every minute you wait, an invisible fire is burning through the pages of your life, your memories, your ability to walk, and your freedom. I've sat with too many families who waited just 2 hours too long, only to watch a vibrant person lose their independence forever. It is a quiet, steady erosion of your autonomy, and once those cells are gone, they never return. However, you are not powerless. There is a simple 10-second test that can stop the damage before it's irreversible, keeping you in control of your future. If you want to be prepared, comment, "Ready." Now that we've established the stakes, I want to take you deeper into the room where the decisions are made, the emergency department. As a physician, there is one thing I wish I could tell every patient before they ever need to see me. Modern medicine is powerful, but it is not magic. We have incredible tools, but those tools have an expiration date that is measured in minutes, not hours. There is a factor in stroke care that I call the no one tells you factor. In our culture, we are used to the idea that if we have enough money, the right insurance, or access to the best hospital, we can fix almost anything. But when a stroke hits, the most expensive specialist in the world becomes powerless if the clock has run out. Why? Because the brain is the most time-sensitive organ in the human body. Once the golden window closes, my hands are tied. I've had to look into the eyes of families and say, "I'm sorry, there's nothing more we can do," simply because they waited to see if a numb hand would feel better after a nap. It is the most heartbreaking part of my job. To understand the gravity of this, let's look at the statistics. In the United States, 1 in every 4 people over the age of 25 will suffer a stroke in their lifetime. I want you to stop and think about your own social circle. Think about your spouse, your best friend from college, your neighbor, and yourself. Statistically, one of you is in the crosshairs. This isn't meant to scare you, it's meant to alert you. Because if you are the one who knows what I'm about to tell you, you might be the only person who can save the other 3. Let's look at the why. I want you to use an analogy I share with my medical students. Imagine your brain is a massive, thriving city like New York or Chicago. The arteries are the streets and highways that bring in the essential supplies, food, water, and oxygen. Now, imagine a massive roadblock is placed on the main highway. Suddenly, the trucks can't get in. The buildings in that sector of the city, which are actually clusters of your brain cells, do not have backup generators. They rely on a constant, second-by-second delivery of oxygen. Within seconds of a blockage, the power starts to flicker. Within minutes, the buildings start to collapse. This is where the burning book metaphor comes in. Every single minute that a stroke goes untreated, you lose approximately 1.9 million neurons. Think of it like a library where the shelves are packed with the books of your life. 1 minute of waiting burns 1.9 million pages. These aren't just random pages. They are the pages that hold the memory of your wedding day, the pages that allow you to move your right leg to drive your car, and the pages that coordinate your vocal cords so you can tell your grandkids a bedtime story. Once those pages are ash, we cannot rewrite them. The brain, unlike your skin or your bones, does not regenerate. Once a brain cell dies from a lack of oxygen, it is gone forever. This is why we say, time is brain. Now you might ask, Dr. Whitman, isn't there a drug for this? Yes, there is. It's called TPA, Tissue Plasminogen Activator. In the medical community, we call it the clot buster. It is a miracle of modern science. When we catch a stroke in time, we can administer TPA intravenously, and it travels to the blockage, dissolves it, and restores the blood flow, essentially reopening the highway and saving the city before the buildings collapse. But here is the catch that the general public often doesn't realize. TPA is a double-edged sword. It is a powerful blood thinner. If we give it to you too late, Outside that strict 3 to 4.5 hour window, the damaged brain tissue becomes too fragile. If we restore blood flow at that point, the weakened vessels can burst, causing a massive brain bleed. It becomes more dangerous than the stroke itself. That is why, as your doctor, I cannot help you if you arrive at the ER 4 hours after your symptoms started. The risk of the medicine becomes higher than the benefit. The clock is the ultimate judge. Because time is so unforgiving, you cannot afford to guess. You need a protocol that works in the heat of the moment when panic sets in. This is the FAST protocol. It was designed by neurologists to be so simple that an 8-year-old child could perform it, yet it is accurate enough to identify the vast majority of strokes occurring right now. F stands for face. This is the smile test. If you suspect something is wrong, look the person directly in the eyes and say, "I need you to smile for me." A normal smile is symmetrical. Both corners of the mouth rise equally. In a stroke, one side of the brain, the side that controls the facial muscles, is losing power. As a result, one side of the face will remain flat or will droop. It often looks like the face is melting. Sometimes the person might even have trouble closing one eye completely. If that smile isn't perfectly even, you don't ask questions. You move to the next step. A stands for arms. This is what we call the tray test. Ask the person to close their eyes and hold both arms out straight in front of them, palms up, as if they are holding a serving tray. Hold this for 10 seconds. In a healthy person, the arms will stay level. But during a stroke, the brain loses what I call its Wi-Fi connection to the limbs. One arm will begin to drift downward, or the palm will start to rotate inward, often without the person even realizing it. They might think their arm is perfectly still, but their brain is failing to send the signal to keep it there. This pronator drift is a major red flag. S stands for speech. Ask the person to repeat a simple, familiar phrase. I always recommend, "The sky is blue." Listen very closely. We aren't just looking for them to get the words right. We are looking for how they say them. Does it sound like they have marbles in their mouth? Is the speech slurred or thick? Or, perhaps even more confusing, are they saying the wrong words entirely? They might think they are saying the sky is blue, but what comes out is the cat is green. This is called aphasia. It means the language center of the brain is under attack. If the speech is anything less than crystal clear, the test is positive. T stands for time. This is the most critical step. If the person fails even one of these tests, just one, the time for talking is over. You call 911 immediately. I want to be very clear on this. Do not drive the person to the hospital yourself. I know your instinct is to get in the car and go, but in the United States, calling 911 is your best chance for a full recovery. When you call 911, the paramedics begin treatment the moment they step into your living room. More importantly, they call ahead to the hospital. They trigger what we call a stroke alert. In a standard ER visit, you might sit in the waiting room for an hour. But with a stroke alert, the neurology team, the CT scan technicians, and the nursing staff are all standing at the ambulance bay waiting for you. We bypass the general waiting area and go straight to imaging. Calling 911 can save you 20 to 40 minutes of door-to-needle time. And as we just learned, 20 minutes is the difference between saving 40 million brain cells or losing them forever. Also, do not give the person an aspirin. Many people think aspirin helps with heart stuff, so it must help with strokes. But remember, some strokes are caused by bleeding, not a clot. Giving aspirin to someone with a bleeding stroke is like throwing gasoline on a fire. Let the paramedics and the doctors decide on the medication. Your only job is to get them to the professionals. To show you how this works in the real world, let's talk about a patient of mine named Charles. Charles is 52 years old, an engineer, a man who prides himself on his logic and his health. He's a runner, someone who looks like the last person who would have a neurological emergency. One Saturday morning, Charles was sitting at his kitchen table in a quiet suburb, having a second cup of coffee with his 19-year-old daughter, who was home from college. They were laughing about something when Charles suddenly fumbled his coffee mug. It didn't just slip. It fell out of his hand as if he'd forgotten he was holding it. Now, most people would have said, "Oh, I'm so clumsy today." And Charles tried to say exactly that. But his daughter noticed something. His voice sounded heavy, like he was exhausted or had just come from the dentist. She didn't ignore it. She remembered a video she had seen about the fast protocol. She didn't panic. She sat him down and said, "Dad, look at me. Smile." Charles smiled, but the right side of his mouth didn't move. It stayed flat. Then she asked him to hold his arms out. His right arm drifted down to the table within 3 seconds. When she asked him to say, "The sky is blue," the words came out as a garbled, "The scoop, blue." She didn't call her mother. She didn't call a neighbor. She dialed 911 at exactly 9:47 a.m. She told the dispatcher, "My father is having a stroke. He failed the FAST test and it started 3 minutes ago." Because she gave that specific information, the paramedics arrived with a stroke alert already active. Charles was in the ambulance by 9:55 a.m. He arrived at our facility at 10:08 a.m. Because we knew exactly when the symptoms started, we were able to rush him through a CT scan and confirm he had an ischemic stroke, a clot in his middle cerebral artery. At 10:31 a.m., we administered TPA. From the moment he dropped that coffee cup to the moment the medicine began dissolving the clot, only 44 minutes had passed. Today, 8 months later, you would never know Charles had a stroke. He has a 98% recovery. He is back at work, he is back to running, and most importantly, he is still independent. When I spoke to his daughter later, she was in tears. She said, "I'm not a doctor, I just remembered those 4 letters." And that is the truth. The neurologist didn't save Charles's life. His daughter did, by respecting the clock. If she had waited just 30 more minutes to see if he felt better, Charles would likely be paralyzed on his right side today, unable to speak or care for himself. While the FAST protocol identifies about 85% of strokes, the brain is complex, and sometimes the warning signs are more subtle or appear in different ways. As someone over 60, you need to be aware of these atypical symptoms because they are often the ones people dismiss as just getting older or a bad migraine. Sign number 1 is the thunderclap headache. This is not your average tension headache or even a typical migraine. Patients describe this as the worst headache of my life. It hits like a bolt of lightning, 0 to 60 in seconds. It feels as if someone hit you in the back of the head with a hammer. This is often the primary sign of a hemorrhagic stroke, where an artery has ruptured and is bleeding into the brain. If you experience a sudden, explosive headache that is unlike anything you've ever felt, do not take a Tylenol and lie down. Call 911. Sign number 2 is sudden vision loss. This can take many forms. You might suddenly lose vision in one eye, as if a curtain is being drawn across your field of sight. Or, you might experience sudden double vision or severe blurring that doesn't go away when you blink. This happens when the stroke is affecting the optic nerve or the occipital lobe at the back of the brain. Because it doesn't always come with pain, people often think they just have tired eyes. It is an emergency. Sign number 3 is extreme dizziness and loss of balance. I'm not talking about feeling a little lightheaded when you stand up too fast. I'm talking about the world is spinning vertigo. You might feel like you are on a boat in a storm. If you try to walk, you might stagger or veer to one side as if you are intoxicated, even though you haven't had a drop of alcohol. This indicates a stroke in the cerebellum, the part of the brain that controls your coordination and balance. A staggering walk is a stroke until proven otherwise. Sign number 4 is sudden mental confusion. This is particularly important for seniors. Families often mistake this for a sudden onset of dementia or Alzheimer's, but dementia is a slow, years-long fade. If your loved one is perfectly fine at lunch but by 2 p.m. doesn't know what day it is, can't find the bathroom in their own home, or doesn't recognize a family member, that is not dementia. That is an acute neurological event. Sudden confusion is a cry for help from the brain. Sign number 5 is unilateral numbness. This is a phantom feeling, a sudden tingling, pins and needles, or a complete loss of sensation on one side of the body. You might feel it in your face, your arm, and your leg all at once. People often think they just slept wrong and their arm fell asleep. But if it is only on one side, and it doesn't resolve within a minute of moving around, your brain is losing its sensory input. Sign number 6 is difficulty swallowing. We call this dysphagia. If you are eating or drinking and suddenly you cannot clear your throat, or you keep choking on your own saliva, it means the stroke is affecting the brainstem, the area that controls your most basic life functions. This is incredibly dangerous because it can lead to choking or aspiration. Sign number 7 is sudden nausea and vomiting. This is often missed because it looks like food poisoning or the flu. But if it comes on suddenly and is accompanied by a headache, dizziness, or any of the fast signs, it's not something you ate. It's the result of increased pressure inside your skull. I tell you these secondary signs not to overwhelm you, but to empower you. If you feel weird in a way you've never felt before, if something is sudden, one-sided, or explosive, trust your gut. Your brain doesn't have pain receptors on its own, so it has to send these emergency signals to get your attention. In the ER, we would much rather evaluate you and find out it was a false alarm than have you stay home and lose your independence. Remember, we are fighting for your ability to drive, to cook, to speak, and to live on your own terms. That is the quality of life we are protecting. Don't let the clock run out on your freedom. In my years in the hospital, I have witnessed many medical emergencies, but none are as deceptive or as dangerous as what we call a TIA. If you take only one thing away from our conversation today, let it be this. In the world of neurology, feeling better can be the most dangerous trap you will ever encounter. In medical terms, we call it a transient ischemic attack, or TIA. But most people know it as a mini-stroke. The word mini is incredibly misleading because it suggests something small, something insignificant, or something that doesn't require your full attention. In reality, a TIA is a full-scale emergency that just happened to resolve itself, this time. Imagine you are driving down a busy highway and your engine suddenly cuts out. You lose power, your steering gets heavy, and you're coasting toward a ditch. Then, just as suddenly, the engine roars back to life. You might feel a sense of massive relief. You might think, well, it's working now, so I'll just keep driving and deal with it later. That is exactly what happens in the brain during a TIA. A small blood clot temporarily blocks an artery. Symptoms of a stroke appear. Perhaps your arm goes numb or your speech slurs. But then the clot breaks apart on its own. The blood flow returns, and within 5 or 10 minutes, you feel perfectly normal again. This is the danger of relief. Because the symptoms went away, our human instinct is to dismiss them. We tell ourselves we were just dehydrated, or we sat in a weird position, or maybe we're just getting older. We don't want to make a scene. We don't want to spend 6 hours in an emergency room if we feel fine. But I need you to understand the cold, hard statistics that we see in the clinical setting. Approximately 40% of people who experience a TIA and ignore it will go on to have a massive permanent stroke within the next 3 months. In many cases, that major stroke happens within the first 48 hours. Think of a TIA not as a mini-event, but as a final warning. It is your brain's way of screaming at you that a catastrophic blockage is forming. If you catch it at the TIA stage, we can often find the source, maybe a narrowed carotid artery or an irregular heartbeat like atrial fibrillation, and we can fix it before the engine fails for good. Let me share the story of a patient named Robert. Robert was 68, a retired high school teacher who loved spending his Sunday afternoons watching football and working in his garden. One Sunday, while he was sitting on his sofa, his right arm suddenly went completely numb. He couldn't lift his remote control. He tried to speak to his wife, and for about 30 seconds, he couldn't quite find the right words. Naturally, they were both startled, but within 5 minutes, the feeling returned to his arm. He could speak clearly again. Robert, being a typical stoic American man of his generation, didn't want to bother anyone. He told his wife, "See, I'm fine. It was probably just a pinched nerve." He stayed home. He didn't call his doctor. He went back to his life. 15 days later, the engine failed permanently. Robert suffered a massive ischemic stroke in the middle of the night. This time, the clot didn't break up. Because he was asleep when it happened, he missed the 3-hour window for TPA entirely. Today, Robert is no longer in his garden. He is in a long-term rehabilitation facility. He has lost the use of his right side, and his speech is severely limited. When I visited him during his recovery, he looked at me with tears in his eyes and said, "I thought, because it passed, it wasn't important." That error cost him his independence. It cost him his ability to drive his car, to live in his own home, and to be the man his family relied on. As your doctor, I am telling you, if you or someone you love experiences even one symptom of a stroke, even if it lasts for only 60 seconds and then vanishes, you treat it as a life-threatening emergency. You go to the ER. You tell them, "I think I had a TIA." We would much rather run the tests and tell you everything is okay than see you back in 2 weeks with a life-altering injury. A TIA is your brain giving you a second chance. Please do not waste it. Now let S talk about those critical minutes after you have dialed 911. What you do while waiting for the sirens to arrive can significantly impact the outcome of the stroke. I call this the waiting room protocol, and it's about creating the best possible environment for a struggling brain. The first and most important piece of information you can provide the medical team is the exact start time. In my practice, around noon isn't good enough. I need to know it was 12:04 p.m. Why? Because the eligibility for the clot-busting drug TPA is calculated down to the minute. If the symptoms started at 12 and you arrive at the hospital at 3:30, you are within the window. No bat jiao lux 11:30, ban ko, the jan qua muon. Check your watch, check your phone, and write that time down on a piece of paper or on your hand. It is the most valuable data point you possess. Next is positioning. How the person sits or lies down affects the blood pressure and oxygen flow to the brain. We generally recommend a head elevation of about 15 to 30 degrees. This is roughly the height of 2 firm pillows. You don't want them lying completely flat, as this can increase pressure inside the skull. However, you also don't want them sitting bolt upright, which can make it harder for the heart to pump blood up to the brain against gravity. A slight 30-degree incline is the sweet spot for neurological stability. While you are positioning them, check their breathing. Loosen any tight clothing, collars, ties, belts, or restrictive waistbands. A brain under attack needs every drop of oxygen it can get, and any restriction to the chest or neck can hinder that. If the person becomes nauseated or begins to vomit, which is common in certain types of strokes, immediately turn them onto their side into what we call the recovery position. This prevents them from choking or inhaling vomit into their lungs, which causes a deadly complication called aspiration pneumonia. There is also a psychological component to this. When someone is having a stroke, they are often conscious but unable to communicate. They are terrified. Panic causes a spike in blood pressure and heart rate, which can actually worsen brain damage. Your job is to be the calm in the storm. Hold their hand. Speak in a low, steady, reassuring voice. Tell them, "I've called for help. The paramedics are on their way. You are doing great. Just keep breathing." Your calm can literally help preserve their brain cells by keeping their vital signs stable. Now let's cover the absolute don'ts. This is where many well-meaning family members make mistakes. First, no water and no food. Even if they say they are thirsty or hungry, do not give them anything by mouth. A stroke often paralyzes the muscles used for swallowing. If they try to drink, the water can go straight into their lungs. Second, no medication, especially aspirin. This is a major point of confusion in American households. We are told that aspirin helps during a heart attack, so people assume it helps during a stroke. But remember, There are two types of strokes. One caused by a clot, ischemic, and one caused by a bleed, hemorrhagic. If you give aspirin, a blood thinner, to someone having a bleeding stroke, you could cause them to bleed out and die before they reach the hospital. We cannot tell which type of stroke it is without a CT scan. Therefore, no medication of any kind should be given until the doctors have the images. Finally, do not leave them alone. Not even for a second to go find a pair of shoes or a wallet. Monitor them constantly. Are they still breathing? Is their face drooping more? Is their level of consciousness changing? You are their advocate and their eyes until the professionals take over. Everything we have discussed so far is about what to do when disaster strikes. But as a doctor, my true passion is making sure that disaster never happens in the first place. The most empowering thing I can tell you today is this: 80% of all strokes are preventable. That means for 8 out of 10 people, a stroke is not an act of God or an inevitable result of aging. It is a manageable health outcome. We need to address the 4 enemies of the brain. These are the factors that spend years quietly damaging your arteries until they finally snap or clog. Enemy number 1, high blood pressure. In my clinic, I call this the silent killer because it doesn't have a feeling. You can have dangerously high blood pressure and feel perfectly fine, even energetic. But inside your body, that high pressure is acting like a power washer against the delicate lining of your brain's arteries. Over time, those walls become scarred, thickened, and prone to rupturing. The American Heart Association guidelines are very clear. We want your blood pressure to be under 120/80. If your top number, systolic, is consistently over 140, or your bottom number, diastolic, is over 90, you are living in a danger zone. I cannot stress this enough. Take your blood pressure medication religiously. Do not stop taking it because you feel good today. You feel good because the medication is working. Reducing your salt intake to less than a teaspoon a day and walking for 30 minutes can have a massive impact. But for many of us over 60, medication is the necessary shield that protects our independence. Enemy number 2, diabetes. High blood sugar is incredibly corrosive. It acts like sand in your bloodstream, grinding down the walls of your blood vessels and making them much more likely to develop clots. If you are diabetic, your stroke risk is double that of a non-diabetic. We want your A1C to be under 7%. Managing your carbs and staying active isn't just about weight. It's about keeping the pipes in your brain smooth and clean. Enemy number 3, high cholesterol. Think of cholesterol, specifically LDL, the bad kind, as the gunk that builds up in a plumbing system. Eventually, the pipe becomes so narrow that even a tiny clot can't get through. We want your LDL to be under 100 ml/dl. You can fight this by incorporating what I call brain foods. Wild-caught salmon for omega-3s, walnuts, avocados, and olive oil. If your doctor prescribes a statin, understand that it isn't just lowering a number on a lab report. It is stabilizing the plaque in your arteries, so it doesn't break off and travel to your brain. Enemy number 4, smoking. This is perhaps the most destructive habit for neurological health. Smoking triples your risk of stroke. It thickens your blood, increases clot formation, and instantly raises your blood pressure. However, here is the good news for my senior patients. Your body is remarkably forgiving. 2 years after you quit, your risk drops by 50%. 5 years after you quit, your risk of stroke is almost the same as someone who never smoked at all. It is never too late to stop. To illustrate the power of prevention, let's look at the story of Teresa. Teresa was 65 years old, and quite frankly, a walking stroke risk. Her blood pressure was 165/98. She was a smoker, and she was carrying an extra 30 pounds. She told me, "Dr. Whitman, I've lived this way for 40 years. It's too late to change now." But then Teresa saw her older sister suffer a stroke and lose her ability to speak. That was her wake-up call. We didn't change everything overnight. We started with small changes. She traded her morning bacon for oatmeal. She started walking to the end of her block and back. She used nicotine patches to finally quit smoking. Within a year, Teresa had transformed. Finally, I want to give you a concrete plan of action. In the airline industry, pilots use checklists not because they are forgetful, but because in an emergency, the human brain is prone to panic. You need a stroke checklist for your home. Action number 1, the family drill. This might feel a bit silly at first, but it can save a life. This weekend, gather your spouse, your children, or even your grandkids. Spend 10 minutes practicing the FAST test. Show them what a drooping smile looks like. Have them practice calling 911 on a dead phone and giving clear information. If your 14-year-old grandson knows how to recognize a stroke, he becomes your most important guardian. Action number 2, the medical ID card. In a crisis, you may not be able to speak. Create a simple card for your wallet and a copy for your refrigerator. It should list your name, your emergency contacts, your medical conditions, like diabetes or high blood pressure, and most importantly, your current medications. If you are on a blood thinner like warfarin or Eliquis, the doctors need to know this the second you arrive at the hospital, as it changes how we treat a stroke. Action number 3, the phone setup. If you use an iPhone, set up your medical ID. If you use an Android, use the ICE in case of emergency feature. This allows paramedics to see your medical history and emergency contacts without needing to unlock your phone. It is a simple step that can save 30 minutes of investigative work in the ER. Action number 4, semi-annual drills. Every 6 months, maybe when you change the batteries in your smoke detectors, review the FAST protocol with your home team. Think of the Miller family. They took this seriously. Every Thanksgiving and Easter, they'd spend 5 minutes reviewing their emergency plan. Their friends teased them for being overly cautious. But last winter, Grandma Miller, who is 76, was babysitting her 14-year-old granddaughter. Grandma started acting confused, and her speech sounded slightly slurred. Because they had practiced, the granddaughter didn't think Grandma was just tired. She didn't call her parents first. She performed the FAST test, confirmed the facial droop, and called 911 immediately. She told the dispatcher, "My grandma is having a stroke. She's 76. It started at 4:10 p.m. She takes a blood thinner." Because of that 14-year-old girl's preparation, Grandma Miller received treatment in record time. She was in the hospital for only 3 days. She walked out on her own 2 feet, with her speech fully intact. Preparation turned a potential tragedy into a manageable medical event. You have worked your whole life for your independence.
You have worked for these retirement years, for the chance to see your family grow and to enjoy the fruits of your labor. Don't let a few minutes of hesitation take that away from you. You now have the knowledge. You have the protocol. And you have the power to protect your brain.
Stay vigilant, stay prepared, and remember, when it comes to a stroke, you are the first and most important line of defense. I'm Dr. Eric Whitman, and I'll see you in the next video. The greatest danger to your independence isn't the stroke itself, but the silent habit of waiting to see if a symptom just goes away on its own. If you have ever felt a brief numbness in your hand or a moment of confusion and chose to stay quiet because you didn't want to be a burden to your family, you aren't alone. This isn't because you were careless. It's simply that the system often fails to explain how those tiny, painless moments are actually your brain's final warnings. The good news is that by recognizing these signs today, you have already reclaimed power over your future. You are no longer at the mercy of luck. You are now prepared. If this information has changed how you look at your health, please leave a comment with the words, "I am prepared." I also invite you to stay connected with this channel, not for entertainment, but as a necessary protective measure to ensure you never miss these critical early warnings. Our next discussion covers a silent condition that is even more common than a stroke, and often hides behind daily habits you've had for decades. I share this because I have spent too many years in the emergency room meeting people who only wished they had known this sooner. Protect your brain, and I'll see you in the next video.